Advanced Back Technologies, a medical equipment manufacturer and distribution company, is pleased to introduce the ExtentracElite. In this presentation, you will receive a detailed look into how the ExtentracElite provides freedom and flexibility in patient treatment for individuals suffering with back and neck pain. Patients of all sizes, weight, and shapes are easily and quickly accommodated and positioned in the supine or prone position, depending on initial provocative range of motion testing. Many evidence-based protocols may be implemented on one device. Initial clinical intervention may include vertical or semi-vertical patient positioning. Here is seen the synergy of three-dimensional spinal positioning with natural body weight as the force of unloading. Antalgic positioning may include lateral flexion pre-positioning to mimic the patient's pain-relieving posture, decrease the area of contact with the compressed nerve prior to applying distractive therapeutic force and movement. To ignore antalgic postures and apply therapeutic unloading in the axial is to elicit less favorable treatment outcome. The application of hands-on direct patient contact and manually controlled application of power distraction offers precise application of therapeutic protocols. This is not available with exclusively automated devices. ExtentracElite is the next-generation therapeutic device, where both the precise angle of applied distractive force and dynamic ranges of motion may be applied simultaneously. Patient participation is encouraged. Professional athletes and weekend warriors particularly enjoy the shared participation and benefits of personal treatment input and fine-tuning of applied distractive unloading. The overhead bar is functional for patient exercise, manual auto traction, as well as other therapeutic protocols. Extentrac's rotatable lumbar support section provides precise application of distractive force at an infinite number of angles prior to the application of distraction. Unique to ExtentracElite is a secondary lumbar disc therapy unit, enabling additional treatment options and flexibility in patient care. The ability to free float and unlock the lumbar support allows increased delivery of therapeutic effect with less dilution of applied distractive force from patient frictional resistance. Seen here, the pathway of an inflamed and compressed L5 nerve, impinged by an L4 disc herniation. Prior to initiation of treatment, the patient is laterally flexed utilizing Extentrac's 3D multidirectional spine positioning system to shift disc away from the descending nerve root prior to the application of distractive forces and disc therapy. As cyclical distractive forces are applied, an increase in vertebral joint separation occurs, producing a vacuum phenomenon helping reduce the size and shape of the herniated disc, moving it away from the compressed nerve while potentially enhancing nutrient diffusion into the disc's nucleus and annulus from surrounding vertebral end plates and synovial fluid. Manual hand control buttons provide precise application of non-automated therapeutic evidence-based protocols not achievable with foot control pedals. Seen here is the superior hand contacting, stabilizing, and palpating the spine, providing therapeutic opportunities to apply evidence-based protocols. active patient participation and exercise protocols, speed patient compliance and recovery. Pre-selected angles of flexion, extension, lateral flexion, or neutral spine positions are selected prior to the application of therapy. Treatment begins with application of smooth, comfortable therapeutic treatment cycles. Identical to Extentrac's M3D lumbar spine positioning system is its new cervical 3-dimensional positioning system, matching treatment to diagnosis. Treatment ends and patient is returned to the vertical position. Patient treatment positioning never involves sitting positions. Advanced Back Technologies would like to thank you for watching this video about the ExtentracElite Elite, the next generation in advanced disc and spine therapy. ExtentracElite Elite offers extraordinary features not limited to supine or prone positioning, a prerequisite for evidence-based protocols, including power-driven flexion distraction techniques, in addition to ExtentracElite Elite's quintessential gravitational proprietary protocols. ExtentracElite Elite is truly spinal decompression plus. To learn more about the ExtentracElite Elite and financing options, contact us today at 631-231-0076, 1-877-EXTENTRAC, 1-877-398-3687, or info@extentrac.com, or visit us online at www.extentrac.com.